Hello everyone, this is Dr. Sangeeta Chaudhary again. I'm a consulting physician and today I'm making this video so that I can share certain informations regarding COVID-19 with you. In my today's video, I'm going to talk about the home isolation of COVID-19 patients and how we can manage a COVID-19 patient at home. Since last year, there has been different guidelines and today I'm going to discuss about the latest guideline of home isolation of COVID-19 patients. First of all, we need to know who can be kept under home isolation. As per the guideline, only the asymptomatic cases or mild cases of COVID-19 can be kept under home isolation. By asymptomatic case, I mean the patient who is diagnosed as having COVID-19 by laboratory test, but he does not have any clinical symptoms of COVID-19. And by mild cases, I mean the patient who has been diagnosed with COVID-19 by laboratory test, but the patient also has mild symptoms of COVID-19. Mild symptoms can be symptoms suggestive of upper respiratory tract infection like a runny nose, fever, mild headache, there may be dry cough, but without any breathing difficulty, and the patient is maintaining his or her oxygen saturation or SpO2 by 94% or more than 94% at room air. So these are the patients who can be kept under home isolation, but provided there should be a facility for home isolation at home. That means there should be a separate isolated room for the patient and there should be a healthy caregiver at home. And the caregiver should always be in touch with the treating physician. But there are certain group of patients, those who are not advised for home isolation even if they are having mild symptoms of COVID-19. These are elderly patients of 60 years or more and having multiple comorbidities like hypertension, diabetes, heart disease, chronic lung disease, or having problems with their liver or kidney. So these group of patients can be kept under home isolation only if the treating physician thinks that it is advisable. There are one more group of patients, those who are immunocompromised, means their immunity is not good at present. For example, those who are having HIV/AIDS, those who are cancer patients, those who are under treatment for cancer, and those who are transplant recipients like those who has received a renal transplant or liver transplant and presently on immunosuppressive drugs. These groups are again not advisable for home isolation. Only they can be kept under home isolation if the treating physician thinks so. If the treating physician thinks that it is advisable for them to home isolation, then they can be kept under home isolation. Now, what a patient should do while the patient is in home isolation. First of all, patient should be kept in a well ventilated room. There should be cross ventilation and preferably the windows should be open all the time so that there is good amount of entry of fresh air in the room. The next thing, the patient should be wearing a triple layer mask all the time and the mask should be changed after every 8 hours or if there is any visible soiling of the mask. And if the caregiver is entering the patient's room, that time the patient should definitely be wearing an N95 mask. Regarding the hand hygiene, patient should frequently wash his or her hands with soap and water for at least 40 seconds or else patient can sanitize his or her hands with alcohol-based sanitizer. Patient should drink lots of water to maintain a proper hydration. One more important thing is that the patient should be self-monitoring his or her symptoms. Now, what a patient of COVID-19 should monitor? Okay. First of all, the patient should be monitoring temperature, then oxygen saturation and pulse rate. Okay, the pulse rate and oxygen saturation can be monitored by the pulse oximeter. Patient should also be monitoring his or her symptoms, whether the symptoms are getting better or the symptoms are same or worsening. Patient should also be monitoring the symptom of breathing difficulty, whether breathing difficulty is same as before or whether there is new appearance of breathing difficulty which is worsening, or the breathing difficulty is improving from before. These few parameters should be checked or monitored every 4 hourly if possible. Okay, so these are the things a patient should do while in home isolation. Now let's see what a caregiver should be doing. Okay, caregiver must be a healthy person and caregiver should be available as 24/7 basis, and the caregiver should always be in touch with a treating physician. Now the caregiver should be using mask all the time whenever the caregiver is nearby the patient, or while entering the patient's room. The caregiver should be wearing an N95 mask. That means when the caregiver is in the close proximity of the patient, both the patient and the caregiver should be wearing N95 mask. Okay, the mask of caregiver should not be touched from the outside, and the mask should be changed if there is any visible swelling. Okay, and regarding the hand hygiene, the hand hygiene should be done frequently with soap and water for 40 seconds or alcohol based hand sanitizer. Before entering the patient's room, after coming out from the patient's room, or after touching the patients, after touching any personal belongings of the patient, before preparing food, before eating, after eating, okay, after using washroom. So these are I'm telling, after this thing, every time the caregiver should be doing the hand hygiene. Okay, this is very important. Now one more thing, if the caregiver is washing the clothes of the patient or the utensils which are used by the patients, then the caregiver should be wearing a mask and gloves. Okay, and the things should be washed with detergent and water. Okay, these are the things which a caregiver should do, and the caregiver should inform the treating physician or the health authority if there is any worsening of symptoms. Now, when to seek medical advice, when the caregiver should inform a doctor or the treating authority, is that if the patient is developing breathing difficulty, okay, if the patient is not able to maintain oxygen saturation 94 or more at room air, okay, if there is increase in respiratory rate, okay, or if there is development of confusion, okay, so in these cases there should be the caregiver should immediately inform the treating physician. Now, how we can treat a patient of mild COVID-19 at home? At home, we should always take care of the nutrition and hydration of the patient. Patient should drink lots of water to maintain the hydration, and we can give symptomatic treatment to the patient. In this group of patient, no specific treatment has been suggested. If the patient is having fever, then we can use paracetamol. Okay, we can use 650 milligram of paracetamol, not more than 4 times a day. Okay, if with paracetamol the fever is not subsiding, then we can advise for other non-steroidal anti-inflammatory agents. Okay, then we can advise the patient to do gargling with lukewarm water or lukewarm water and betadine solution at least 3 times a day. Then we can advise for tablet ivermectin. Okay, this is there in the guideline. 200 microgram per kg body weight of ivermectin should be taken at empty stomach once daily for 3 to 5 days. Okay, so these are the drugs which we can use at home. Okay, nothing other than these drugs should be used at home or advised by self. For example, remdesivir or steroids, because these days every time we are hearing about remdesivir and steroids in all the medias and everywhere. So we should not be using these drugs by our own, or we should not use these at home. So if we are having any confusion, or if there is any need for remdesivir or steroids, okay, then the caregiver or the patient should be in touch with the treating physician and should inform the treating physician. Okay, so this is how we can treat a patient of mild COVID-19 at home. And lastly, when to discontinue isolation. Okay, the guideline says a patient stands discharged after, at home isolation, okay, after the 10 days of onset of symptoms, or if there is a fever free period for 3 days. Okay, so these are the criteria when a patient can be when the patient can come out of isolation. Okay, so these are the informations which I wanted to give. Okay, if there is any queries, you can ask me. Thank you so much.